it's very frustrating. You have to pay like money.
Oh yes, Canada, nothing is free.
It's like $1,000
Something like that. I think for me to write the Canadian boards, it'll cost me about 50 pages of handwritten paperwork and close to $10,000. It's like $5,000 just for the test, and then I have to get accredited by 5 different groups, so I don't even know what they do, and they basically only exist to suck money out of people.
Yeah.
And then the government taxes that because it's a service, whatever it is that they are doing.
So,
yeah, if you're using a streamer, you could put this for the colleagues that do that show up to us. We're thinking it might be advantageous, especially for those 2-part lectures or sometimes, yeah.
well, I can send you the actual PDF that you can send out.
Well, I'm going to have both other comments if you don't mind.
Oh, is it commentary as well?
Yeah.
Is that little thing?
Yeah.
What sort of format is that?
Gigantic wave file.
Yeah, I'm going to put it on a private server for some FC reference.
So can I say something which means everything I'm about to say should not be used against me or something?
Absolutely.
Miranda rights.
Full disclosure.
So shall I wait?
No, it's getting to that time of year where people either come or they don't.
Okay, well, this is actually based on the lecture I give to the medical students on, they get this in about the first week of medical school. It's a bit late for you guys, though, isn't it? Do you remember this? A little redundant. But I think it's nice. It's actually best up front like that, because I think it does give people perspective. It's good for them. That's good. So Darwin's theory, it's very, very simple, undeniable, it's inevitable, it's a mathematical certainty. So it's not a question of belief or not belief. Evolution exists. So the concept's simple, but there is obviously differences in survival. Not everybody survives. It's also true that it's the traits that enable you to survive or not survive are genetic and inherited. So there's going to be a selection pressure, and natural selection rather than natural selection, social selection. And because that is inherited, is genetic, then you're going to get a difference between the different generations. And that will trend in a certain direction over time, and that's what evolution is. So we can apply this to our species just like any other species, like every other species. And of course the overlap, the big sort of Venn diagrams with evolution here and medicine there, there's going to be some overlap. So as physicians you will see patients, and of course most of the time it's a problem that is really a problem, a defect. But sometimes the symptoms that are being addressed are actually a defense by the patient. And so it's important perhaps sometimes, and I'd actually appreciate any feedback from you guys as to some better examples of the ones I've got, or some additional examples, of where it's really not appropriate to treat the symptoms. Let them run their course, because it's actually benefiting the patient in the medium and long term, even if perhaps not in the short term. So, and these are some of the reasons, I've got 6 categories here, of why we see patients having problems. So is it really a defense or a defect? Are we going to treat or not treat? A big part of what's going on, of course, is that we are just one species amongst many, and we're in a competitive situation. For some of these other species we're hosts, for some of them we're prey, for some of them we're symbiotes, and so on, commensals, all sorts of different relationships. We have an immune system that's a big part of what keeps us going, so that we can keep on top of the huge army of bacteria and viruses and God only knows what else, which like to devour us. But there's a compromise in that as well, so that often when the immune system, which we're so heavily dependent on, can go wrong and result in cancer. So we're going to have compromises. We're going to have balance between these different. We can't optimize everything. Our environment is changing, and of course, faster now than ever before, probably, with man's now influence on top of everything else. We have a legacy, and you can't really change as fast through genetics as we would like to be able to sometimes. And so we have these historical legacies that are weighing us down in a sense. So, natural selection, the inevitable result from the variation in the inherited component of the reproductive success. Those that are adapted will have more offspring. Form will follow function. It extracts order from randomness. So mutations occur at random, but there's a selection pressure which is going to select some things and not others, and that therefore will put an order onto that random background. So it's trial and error, and it's not sensible design. There are going to be functional restraints, so we can't suddenly grow wings or something like that. It would be quite an advantage to be able to fly. So here's a beaver. Obviously, it would get a lot more trees down if it had a chainsaw, but it's not going to suddenly grow a chainsaw on its appendage. And there is no direction in intelligent design. It's one of the most stupid things I've ever heard in my life, is this concept of intelligent design. So the fish here is being told to get up there and take over that untapped resource up there. Are there problems? Of course there are. And here's a nice list of some of the major problems that keep you guys going. Is job security for you in this list? I would think somewhere. If there wasn't, we wouldn't need physicians. So we have a fairly bad design when you think about some of the things. And it's, for example, every time we swallow, we have to close our airways to prevent choking on our own food. Why are the nostrils not positioned in a different place so that we wouldn't be choking on our food? Again, when you start asking some of these questions, you think, well, that's not the greatest design in the world. Look at the human eye. I mean, doesn't the light travel through the blood supply to get to the light sensitive cells? It's very poor design. And that's the legacy. What's normal? There's something called restless leg syndrome. I have no idea what it is or if it's real, but apparently it's common. I don't think 14% of people have perfect pitch, but so that maybe even so. Anybody here left-handed? No. How about your earlobes? Do you have? And what about wet or dry earwax? So, there's no such thing as really normal. So here's some of the strong family history seen in different conditions. So these are genetic background to some of these things. Now cancer, of course, you can have familial, only about 10% of cancer is sort of clearly Mendelian familial type situations, but you could almost think of cancer, every cancer in a sense as a genetic disease, in the sense that it's, as we now know, so much of it is to do with changes in the chromosomes and the genes. Even if it's somatic, it's still, to be thought of in a sense, genetic once it's within that individual. Why are some modern diseases so common? Well, we can talk about things like addictions and hypertension, cancer, diabetes. But we have some idea of what's going on, why these diseases in particular are becoming much more common. Now, one of the biggest problems is, of course, we're a victim of our own success, and the average lifespan has increased enormously recently, which means we're now facing such long lives that we're facing situations where there hasn't really been any selection pressure. So, let me ask you, if your job was to make everybody live longer, how would you go about doing that? Okay, come on.
Well, obstetrical care would be biggest bang for the buck, I would think.
The what?
Obstetrical care would provide the biggest bang for the buck, I would think.
Obstetric?
Yeah, because if you kill a 1-month-old,
Yeah, no, but what if you want? What if your job was to, the average age is what, 85 or 80 or something? What if I told you your job as dictator of the world is to now extend that? Your job is to
make them exercise, eat better.
It's not McDonald's, but I would not like to do that.
close down McDonald's. See, I think like a geneticist. I think, okay, so what you do is you start selection, and so you stop people breeding until they're in later and later, and then you take that's how you gradually increase the age of the species, is selection like that. Yes, you can do these things on the environment, that will extend it up to a certain point, but you really need the genes rather than the environment if you're going to have long-term response. Now you may hit a wall eventually, our species, but may still hit 120 or whatever it's going to be. But so really address it. That's how you
Still run into troubles there because like maybe people breed later has its own problems. So you really want to just take gametocytes, hold them, see how long they live, and then only mix the ones that live with them.
So what are the characteristics?
I don't know this.
I'm glad someone else has. Okay, characteristics of our species. We have relatively long periods of helplessness in our young. Rather large heads, long maturation, as I know with my oldest is back at home still. He's gone off to 4 years of college and come back and he's living at home. So this long maturation period is getting longer all the time. Relatively long lifespans. Long post-reproductive life in females. And I think perhaps this might be something to do with the grandmother hypothesis, where there's actually a good selective advantage by having grandmothers. I'm not sure what happens to grandfathers, but grandmothers coming home and helping, being at home and helping with the raising of the next generation. We're particularly good at recognizing facial features. I don't know how much of our brain is dedicated to this, but it means we can recognize and hold the images of lots and lots of people and continuously. If you look at one penguin, they look pretty much like another penguin to us. I don't know if we were penguins that we would recognize individuals by features that are too subtle for us, but we're certainly very good at recognizing our own species. And of course, language and tools and drawing stuff like that. We're supposed to go, Okay, so let's think of the different reasons that we see some of our ailments. Is it a defect or a defect? And we need to distinguish between these because it may not always be the best idea to treat and get rid of the effects of a thing when it's really defects rather than a defect. Anaphylactic shock is one example. Of course, that can kill you, right? So maybe you do need to do something about that. So some diseases are more serious by an over-enthusiastic immune response. So it's actually the body's response which is a bigger problem than the actual initial problem itself. So a lot of that, like sneezing, what else? Coughing, runny noses, fevers, nausea and vomiting, diarrhea. These are all part of a sort of compromise between our bodies wanting to get rid of these infectious agents and the infectious agent wanting to be dispersed to find a new host. And so this is the sort of place that they end up where these help both the host and the bug. So what might be good for an individual may be bad for the neighbours. You might consider letting your symptoms run their course, but don't go to work whilst that's happening. Allergies, an oversensitive smoke detector in a sense, inherited component. We don't know why, but increasing in frequency. Can be, you can obviously take medication, but there's usually side effects to the medication, so who knows. But this is one of those situations where there's a balance in selection because individuals, on average obviously, who have allergies and are in a sense oversensitive immune system and making their lives a little bit miserable, are also often have low frequencies of cancer. So there is a compromise between these two things. Organ transplant recipients in the US double their risk of developing cancer compared to the general population. Let me put it out there, should patients always take antihistamines? Okay, so there's overwhelming evidence in favor of fever being an adaptive host response to infection that has persisted throughout the animal kingdom for hundreds of millions of years. This guy intentionally infected thousands of syphilis patients with malaria. Used fever induced by the syphilis. Oh, that's the other way around, isn't it? Used the fever induced by the malaria to treat the syphilis. That's the wrong way around. I keep correcting that, but I obviously keep correcting the wrong version or something. They keep creeping back in again. And increase the remission rate from 1% to 30%. So that's a pretty good advance, of course. You're not going to be able to do that these days. But he did win the 1927 Nobel Prize.
Now you can go to jail for that.
Yeah. You wouldn't even be allowed to think about doing something like that, would you? Okay. Anemia. Well, apparently, would you call that a defense or a defect? And apparently, iron is one of those things that are in short demand, and so by reducing the availability of iron in the blood, it's actually making a more hostile environment for the infectious agent, and so it's actually part of our defense. I guess, like everything else, there's a compromise between what levels you really want to keep yourself alive as opposed to making it hostile for the blood. But it raises the question, do you always want to treat anemia? So do you have other examples in your background here, life as physicians, as to how you could think of things that on first blush you'd think, oh yeah, we've got to treat that, and then if you think a little bit harder about it, you think, well maybe we don't want to treat that. Or is that really hostile? Is that blasphemy? Are people always going to say, if I'm uncomfortable, treat me, I'm just not going to let you leave me, without in discomfort, even if it's going to be good for me in the long term. It's just not.
With like back pain, just always give patients opiates, and then they wind up getting hooked to them. So it just becomes more detrimental.
But they do it anyway, knowing it. So obviously we have this evolutionary, natural, instinctive response to certain things in the environment. Apparently you can take, these colonies of chimpanzees that have never seen a snake, and they have no experience as a colony of snakes. Put a snake in there, and they will go bananas. And so they just know instinctively, they have the genetic predisposition to know that snakes are trouble.
Yeah, that happens with humans and functional MRIs too.
Say again?
That happens with humans on functional MRI.
Who just flash a snake?
Yeah,
and
you
just
show
instantly
a
get
2-year-old who's never seen a snake, lives in New York City yet. Functional MRI will actually experience fear. It's the only animal that they routinely have that effect.
A snake,
Yeah.
in particular.
Yeah.
So isn't that amazing? And it sort of occurs to me things like birds. You can take them, certain birds, they're out of a nest, put them in a different part of the world, raise them, and they will still migrate in exactly the right direction, but it's now the wrong direction because they've been put in the wrong part of the world to do it. But they have, in other words, in our DNA, instructions, fly northeast for 300 miles or whatever it is. It's extraordinary what is being passed on from one generation to the next. So pain is useful. Apparently people who cannot feel pain are usually dead by the age of 30. And apparently that's what leprosy is a big problem with leprosy, is that the pain, they don't feel pain, and so because they're not responding, they gradually lose their digits and things because they're not recognizing in time that their hands are getting in a bad situation. Of course, we need pain and fear in moderation. Obviously, too much of anything is a bad thing, particularly, you can't get up and get out of the house with too much fear. That's a bad situation as well. Conflict. Host versus parasite. The answer is plant versus herbivore. And of course the irony there is that many of the plant toxins which were designed to make the plant distasteful to the herbivore are now what we actually grow those plants for, because we actually find it varies our diets and stimulates our palates and so on. So there's a lot of irony in that, if you think about it. Conflict between the sexes. So this is interesting in terms of the males and female strategy in terms of how they want each particular fetus to do. So there are these imprinted genes, male and female imprinted genes, and the male imprinting of the genes tends to result in an increase in the size of that particular fetus. The female imprinting of the genes tends to reduce the size of the fetus. And it's all to do with the fact that the male may not be the father of the next fetus, so he wants to get as much out of that mother into that child because he's the father and he wants his genes to do well. And the mother's trying to think ahead to having many or more than one fetus, so she's trying to proportion her resources over time. And that's, again, this is one of these cause and effects sort of idea. You see a correlation, you come up with an explanation. But apparently, if you do look at the genes and what they do, it sort of makes sense that maybe what's going on. Parent versus offspring. So preeclampsia is an example of where something the fetus is doing is resulting in a not such a great situation for the mother. And then genes themselves can be selfish. I don't know examples in humans, but certainly in the mouse is the T locus. So if you have a big T, little t heterozygote, you'd think you'd have 50% big T, 50% little t in the gametes. In fact, you don't. You have like 99% big T. So something happening to the little t alleles. They're just not making it. On the other hand, if you have a big T homozygote, that's lethal. So it maintains the big T in the population, and that's called mitotic drive. Now, I'd like to say I don't know of examples of this in humans, but it's still an idea, and I guess it could exist, it just hasn't necessarily been described. Morning sickness. Why do women get morning sickness? They develop food allergies or aversions. This corresponds with the fetal vulnerability to toxins, so it tends to be the point where the fetus really wants a bland diet so that it's not being compromised by toxins in the mother's blood. So it's protecting the fetus. We talked about the imprinted genes. So, arms race. 400 generations of humans takes approximately 10,000 years, 25 years per generation. 400 generations of bacteria takes about a week or two. 400 generations of virus, even less time. Bacteria can evolve in a day as much as we can in 1,000 years. And so in a sense, that last ice age was a week ago. All bacteria are gut from people on the planet, so they have numbers and they have generation interval advantages. So in a sense, we should be just gone out of here. We should have been out evolved a long time ago. All we have is, well, we now have medicine, so we can have, that's helping us. But really sex is our only thing that we have to compete. And sex, our immune system and medicine now. Because sex, again, it seems to have evolved primarily to provide a constantly changing target to anything that wants to eat us or live on us, consume us. And by randomly combining genetics, as we do in meiosis, producing new individuals, every individual is different. And so that means there isn't any one single monoculture type target. So we're going to have some resistance, some susceptibility, but there isn't going to be complete susceptibility. There's going to be some resistance, which means that the bacteria can't evolve without sex very quickly. They're stuck, they can change fairly quickly in some senses, but without sex, nothing like as fast. And so we can keep ahead that way. So big fleas have little fleas upon their backs to bite them, little fleas have lesser fleas, and so ad infinitum, by Jonathan Swift. So everything has something almost continuous. I just included this because I thought it was gross. I'm not sure that these guys actually cause problems. Does anybody know anything about these guys?
When we get any sections of skin, you sometimes find these little things
crawling around. And do you ever look at eyelashes like that and see them buried at the base like that?
Not so much, but that's where they hide out in other areas of skin too. We just call them demodex and other places.
Yeah. But I don't think they're particularly harmful, are they? And there's that one on the left that's obviously, it's got little ones on top of it, is that right? Or am I imagining that? Those little orange things seem to be other little worms. Or, you know, it just seems to make my big fleas with little fleas. Okay, and then we can look at the molecular level, and you know, about half of our genome is made up of repeat DNA, and in some ways you can think of these as having been parasites, at least in the past. You know, short and long repeats. Most of them are now fairly stationary. There's not many of them that are still jumping. But you know, if you look through enough mutations, every now and then you'll find an ALU insertion that's mutated that gene. So there's this obviously downside, and people really thought of these as being a problem. But there's another way of looking at it, which is that they've also enabled our genomes to be much more adaptive and flexible and plastic than otherwise. And in fact, some suggestions out there are that one of the advantages of our species is that we are very, very adaptable. And one of the reasons for that is that our genomes are doing this. And so these very things that are in some ways clearly parasitic are in some ways giving us a huge advantage. So it's just funny, again, which way you look at things, whether things are good or bad, half full or half empty. So mutations going on, new microorganisms can rapidly evolve drug resistance. So this is a constant battle we're having. Given a frequency of 10 to the minus 10 replication errors per base per cell division and an estimated 10 to 15 cell divisions in a lifetime, then expect thousands of new mutations in each cell at a time. Of course, what we're talking about here is cancer, if those occur in the drivers as opposed to the passengers. And so, in the same way as we can think of cancer, we can also think of bugs and so on, and bacteria. But there's a constant arms race. Vaccination can exert a strong selection pressure for resistance. Population genetics of HIV make it clear that using several drugs at once is better than sequentially. If you use sequentially, you can gradually, again, through that selection I was talking about, how do you get really old people? You do selection, one at a time, slowly, gradually lose something. And so that's not a great idea, that you'd be selecting for resistance in HIV if you did it sequentially. So that's just that idea of how sequentially cancer or drug resistance or something like that. So we compose of about 100 trillion somatic cells, most of which are terminally differentiated. However, we are the product of countless number of uninterrupted germline cell divisions stretching back to the origin of life. So we have evolved multiple safety mechanisms to safeguard against inappropriate somatic cells. In other words, we're asking most of those 100 trillion cells that compose our bodies to do something that has not happened in the 5 billion years of life on the planet, which is to stop dividing. And so we have to have a fairly secure way of making cells do something that they haven't done before. Thus, most cancers are the result of multiple genetic changes. There's usually a driver, but then there usually have to be other subsequent changes. These gateways, these gatekeeping gates are opened up so that the cells can start doing something the body really doesn't want them to do. So that's just one way of thinking about it, you know. And I think it's a fascinating idea if you think about it.